you have no one and you're scared. Who you supposed to turn to? The one person you're supposed to turn to is your social worker, but what if they don't accept you either?
There's so many young people who identify as LGBTQ who are not accepted by their family, who are not served in the child welfare agency like they should be served. That's why this work is so important, because they need to feel accepted, they need to feel cared for, they need to feel safe.
I just want people to realize how important it is to have LGBTQ spaces for foster care youth.
The intersection of LGBTQ plus and foster care is not one that is commonly talked about. We don't talk about it because so many people are afraid of making people uncomfortable, or they generally just don't know how to talk about it.
I feel like often professionals come with good intentions to serve this population. They come with the empathy, they come with the love, they come with the support and with the engagement. I think that often they lack the education, they lack the kind of openness that's needed. And they still haven't maybe done some kind of self-evaluation to see where they stand on issues, and that I think that you have to kind of do a self-inventory in order to work with the LGBTQ population.
So we know that LGBTQ youth are overrepresented in the child welfare system. We've seen from several studies that they make up 20 to 30% of the youth in out-of-home care. And we also know that they report poorer treatment while in care. They move around more frequently, and they have lower permanency rates. And so this project was developed so that we could partner with child welfare agencies across the country to design, implement, and evaluate programs for LGBTQ youth, their families, and the workforce, with the hopes that we find out what works to help increase stability, increase permanency rates for this population, and improve overall well-being.
I think it's important to recognize that doing things the way that you've been doing them all along is not going to get you any further down the road. It's taking the risk and taking the challenge to try to do it differently.
So this project's important because there are no evidence-based interventions for LGBTQ youth and their families involved in child welfare systems. And so we have no documented evidence of what works and what doesn't in helping families reunite or solve family conflict when it's related to sexual orientation or gender identity. There are also only 2 or 3 manualized programs across the country, and this means that they have materials that make it possible for providers to replicate the work, to train on the program, to provide written instructions to their staff on how to implement the model. And so what happens is a lot of providers make up their own programs, or they choose not to implement any programs at all just because there is such a lack of evidence and instruction on what works and doesn't work for these families.
I'm grateful that we were selected, and it is a privilege to do this sort of pioneering, groundbreaking work. But more importantly for me, it's a privilege that even if one kid is helped and one caregiver, that's, that's worth everything.
So we're working with 4 sites across the country. One is Allegheny County in Pennsylvania. We're working with the state of Michigan. We're working with Prince George's County in Maryland, and we're working with Cuyahoga County in Ohio. And all of these sites have joined us in this effort to design interventions for LGBTQ youth, their families, and the workforce. And with them, we will be helping implement the interventions and evaluate their effectiveness. So we have several interventions across different categories. We have 3 staff and caregiver interventions that are focused on training. We have 2 SOGI data collection initiatives that will be looking at how to collect data on sexual orientation and gender identity. We have 3 individual clinical interventions for families, and we also have 3 group clinical interventions for families. We have 3 group clinical interventions for LGBTQ young people and 1 adapted family finding intervention. So there is a lot to do on this project. We're covering a lot of territory, and we hope that by the end of it, we'll know which of these programs works, what do they do, how do they not work so well, and be able to provide the field more information on what they should be providing to this population.
We hope to see a change in the number of youth who achieve permanency and hopefully a decrease in the number of LGBTQ youth that are in the system.
So much of what's been done with LGBT young people on a public policy level and a program level has just been to prevent people from hurting them. And I think what's really different about this is that we're actually trying to show people how to promote wellness, which is so important.
But what has been amazing was the upfront work that we did around practice profiles, implementation plans. Some of that at first didn't feel like it was going to be helpful, but now that we're actually implementing the programs or implementing the intervention, I am finding that being able to go back and as we're developing the fidelity tools, how important those have been and have provided the roadmap for us in doing the work with young people.
I think if we don't know who these kids are, then we can pretend they're invisible. And that we won't be able to serve them, we won't be able to help them. And I think that does start from the policymakers and the leaders and the legislators of our county, all the way down to caseworkers. And so that data to show, wow, I think provides impact across all of those stakeholders. And that's really important.
The sites will be required to move through implementation stages. The first is really about understanding the problem. Who's the target population? Having a well thought out solution to whatever problem has been identified, and then measuring several indicators of readiness. The second stage is really about installing all of the pieces that need to be in place prior to serving young people and families. So this could be hiring staff, training staff. It could be developing the procedures for data collection. The next stage is focused on initial implementation, which provides sites an opportunity to use rapid cycle evaluation and data to really inform improvements around their implementation and their intervention. So they'll be getting data really frequently so that they can see if what they're doing is working, if it's working in the way they intended it to work. Are they getting satisfaction surveys that are, providing positive comments from young people and families? If not, there's an opportunity in this initial implementation stage to make adjustments so that they could be happy with how everything is working before we really dig in to the last stage, which is about evaluating the model's outcomes. And so in that last stage, there are less big changes that happen to implementation and the intervention itself, because now we're evaluating, does the model work? And so those are all the stages that the sites have to work through over the next several years with us.
And I think it really has been an honor, but it's also been such a learning experience to have the framework of implementation science and to be able to recognize that this is how every project works. Like you do have to go back and forth from exploration to implementation and, retune everything and modify and, change course and go back to figure out how this should really work. And that is the power of doing that is helping people to stay positive and to stay focused.
One of the things that is unique about this cohort is that most of us are working in Rust Belt city areas, and I believe that this will be the first time that we have a critical mass of data from the Rust Belt that is focused on LGBTQ2S youth in foster care. And that is really important to us in Detroit because we are incredibly grateful to all the work that's happened on the coast. And sometimes there is resistance from folks in our community when we share data from California or New York, because there's a lot of ideas about what can happen on the coast versus what can happen in our community. And this is an opportunity for us to show the power of what is already happening in Detroit, what has been happening in all these Rust Belt communities, that it's not new, but we're just documenting it in a way that gives it validity.
I remember distinctly standing in front of county council and talking to them about, why this work is important and why this contract should be approved. And, they asked for data, and I was so excited because I was hoping that they would ask about, how things are going, but, I could see everyone's eyes light up when, at that time we had 80 some kids identified, we had, 10 or so kids involved with chosen affirming family finding. And we were getting ready to start with youth acceptance project and to tell them how many caregivers have been through Affirm for Caregivers. And when I saw their eyes light up and that level of understanding, register with them, to me that was, I understood the power of that data and how they understood exactly what the project was about at that point.
We do have resistance to using pronouns at our meetings. They're pretty well behaved, so they don't usually say it to us while we're doing the presentations, but I do hear from other people later that there was quite a lot of discussion after we would leave a department meeting about why we have to do this. So I think, though, that will change. I think it will change little by little, and it's not something we're going to see overnight, but we're making progress.
The biggest challenge in the work has been the red tape, mostly from our agency standpoint. We have had a policy written and that's been proposed and edited a few times. It's still waiting for final approval, so we can't go forward with that. And there are several other things dependent on that. So once we get that approved, then we can finish our practice guide. Once we get that approved, we can finish some of these other little things we're working on as far as internal with our agency. And it's just, there's such a long waiting process to get things approved that it has been a little bit of a struggle for me.
We've had a lot of challenges around communicating the program to staff, with a lot of the challenges currently occurring within the county, with caseload sizes. It has been difficult to give information to caseworkers that they retain and are able to then remember to talk about with their families. And so we have found that one of the challenges has been just getting the information in front of them to say, this is a program, this is what's being offered, this is who qualifies, this is who you should refer.
I would say the biggest challenges have been choosing interventions that aren't fully fleshed out. This is a really new subject area, so we don't have decades of methodology in going in and choosing an intervention that has been tested, and that's what we're doing right now. We're testing these interventions and we're trying to create a model for other people. So it feels like we are in some ways building the plane while we're in the air.
What goes hand in hand is having skills for the worker to develop who's doing this work, and then having a supervision tool to support that worker in doing the work with young people, because it's not just them, it's their families, their networks, and it's the professionals and the system professionals. Navigating all of that is a big job. The importance of team building was crucial. We were able to do that, which I'm really excited about, and so that came together for us. It just took us a little bit longer. So that realization came when we were dealing with system barriers, and as a team realized that we weren't aligned and that we needed to create an alignment and shared understandings around how to do the work successfully.
I hadn't worked with our SOGI data to any great extent before this project started, and so now taking a closer look, I was certainly aware of all the work that we've done to make it easy to collect SOGI data from our clients, and recognizing that there are really big gaps and we're not doing a great job of collecting it. We've sort of put the system into place and it's doable, but folks aren't doing it. So seeing where those gaps exist and then trying to figure out how to address them.
So one of the biggest challenges that we encountered on this project was adjusting all of our work due to the COVID-19 virus. So right as sites were about to move into a period of steady implementation, they had made all of the major adjustments to their programs and implementation, and it seemed like this was going to be sort of smooth sailing. Our work was totally thwarted by the COVID-19 virus. It required all of our programs and initiatives to move online and into virtual platforms. And so everything had to be readjusted. It had to be rethought, rewritten. Protocols had to be redone. IRBs had to be resubmitted. So it really was just everything needed to be changed really quickly. We only had about 2 years left on the project. But even despite that really big challenge, the sites totally rallied around it, and many of our programs were implementing their new virtual implementations within 3 months, which is also such an accomplishment.
I would say there have been a lot of challenges along the way. Most obviously and most recently, the biggest was the pandemic. However, I think what was most impressive about this group of people working across multiple sites is that every challenge was met with a solution. No one ever gave up or took the easy way out. Everyone kind of hunkered down and utilized each other to think through what would work. And then they would try it out. And if it didn't work, they would try it out again. And they would do that until they found a solution. And everyone kind of worked together as a team, both internally within the site, peer to peer with the sites, with each other, and then also obviously with our QIC core team with the sites. And I think so often we see that when sites are implementing innovative practices, that innovation takes hold. And it certainly could have during this process. I think that there have been periods where all of us, we felt that at a moment. But no one ever gave into it. And that's what was really exceptional about this project.
I think what surprised me most about the process of being a local implementation site through a quality improvement center, frankly, is just that as a social worker in the United States, that this was my first exposure to a process like this almost makes me feel frustrated, because to me, this is really exciting. It's a whole roadmap of how to improve our services, how to go back, go deeper, figure things out that we know are crucial to supporting some of the most vulnerable youth in our systems of care. And so to me, I guess I've almost just been surprised that we didn't know about this kind of work earlier. And to me, that's a very pleasant surprise that there's finally kind of these buckets to put our concerns or our questions or to name what we don't know yet, and for that to not be something that's shameful, but an exciting research question that if we don't know the answer to that, that's okay, and we need to study that, and that's how we're going to build knowledge together.
Surprised about just the level of intensity of the work. We have this waiting list of young people at this point, so it's like, okay, we didn't anticipate that we would have all of these young people on a waiting list, and how do we, provide some other things?
So we had an idea of what best practice looks like, but it's really important now that we're actually doing the practice to continue to refine that. So for me, that's been surprising but rewarding.
I think one of the things that surprised me the most is that everyone is still here and involved. I mean, if you ask anyone who's participated in a project that's like this, they will tell you about the turnover in leadership and how that created barriers to the projects moving forward. But we didn't really experience that. And I think that tells a lot about the commitment that the folks who started in the beginning had to stick with this through the whole process. And that was really surprising to me. I think I had prepared myself for turnover and not necessarily being able to build the same kind of relationships we were able to build across the sites. And I think that we did that. I think that people have really established a lot of strong relationship between sites, between us and sites, within sites, and that's been surprising and really rewarding to be part of. And I think that that demonstrates everyone's commitment to the work and commitment to improving care for LGBTQ plus youth and their families.
As an agency perspective, I would say that I'm most proud of our culture shift, the way that we're presenting it so that it's in everyday pieces of what we do. People are comfortable with it or more comfortable with it.
There are many successes that we've had on this project so far. The one that comes to my mind is our pronoun campaign. I believe that pronoun campaign has really helped to start shifting the culture in our agency and in our community, because everywhere we go, everybody who sees this pronoun button wants one. They want to know what it's about. At a Martin Luther King Volunteer Day, there were a couple of foster children there, and One young person asked for a button, and when they came back from the button basket, she had on her buttons. And she said that it's really scary to come out as transgender by dress or by hair, but this made it so much easier for her. And that was the biggest success I could have ever seen.
So another important contribution was that we identified that 32% of young people between the ages of 12 and 21 in out-of-home care in Cuyahoga County identified as LGBTQ. So prior to our study on this, the field had data from Los Angeles and New York, which are two big coastal cities that are known for having really diverse populations. So this study demonstrated that the prevalence is also high in the Rust Belt, and it helps make the argument that this is likely similar across the country.
I think, for us in Cuyahoga County, the most exciting thing has been, and fruitful, has been the safe identification of our young people. I mean, when we started, we had identified, just a handful of kids. At this point, we have 115, and that will continue to grow. And, in some ways, I feel like we've just scratched the surface, and this is what we have. And how great it is, because once we know who those kids are, then we can serve them appropriately, make sure they have affirming placements, make sure their caseworker is competent. And for me, that has been the most fruitful and the most remarkable change.
We took on 4 interventions through the QIC. 2 were system focused and 2 were direct services with LGBTQ youth and their families and child welfare. And while a lot of this is work that we were doing before we were engaged with the QIC, we didn't have the capacity to really systematically package and study what we were doing in a way that would be ready to share with the field. And so for me, especially as a person who's been a caseworker, who's been a clinician in these different systems of care, to be able to offer the field resources is such an important accomplishment.
I am proud of so many things, but if I have to pick one thing, I would say that I was just so impressed and so proud of everyone's ability to pivot and move practices virtually. And what was so impressive is that this didn't happen just because we wanted to try it out. This happened while people were simultaneously living through a pandemic and everything that pandemic brought. And everyone, including our QIC team, who had to reconceptualize the evaluation in a virtual environment, who had to support sites to rethink how they were going to make practice happen in a virtual environment. The sites had to do all of the work to make that happen. Young people and families had to do something totally different that they hadn't done before in order to access these services. And everyone did it, and they did it quickly, and they did it well. And I think that that was so impressive and something to be proud of, not just for me, but for everyone, that people were able to pull that off. When we started this, we weren't thinking about virtual interventions, but we do know that LGBTQ plus youth and their families live in rural environments. And we don't know that these interventions would have been applicable in environments where transportation wasn't a possibility. But now we have a version of these models that can be implemented in rural areas. And I think that there's so much tragedy that happened during the pandemic, and I don't want to minimize that at all. However, this is something that I think that came out of it that wouldn't have if the pandemic didn't force us to test it out and try it.
One of the things I am most proud of is the level of passion and commitment that I've seen rise up in child welfare from all levels. Deputy directors, managers, supervisors, clinical managers, caseworkers, just really become passionate about serving LGBTQ kids and supporting families that I think was probably there, but was really unearthed in the last 4 years.
I am really proud of how much we've grown, going from paper, from grants and ideas to actual implementation has been a joy to watch. It's been a struggle, but it's also just been very exciting to see the program grow, to see us bring on staff, to see us provide services to LGBTQ youth and their families. To see the data that the QIC has collected and to see how impactful our work has been, it's been extremely motivating, and it's been very just a joy to watch our program grow, to hear the feedback from so many different organizations that we worked with and how excited they are to work with us and how great Prince George's County has been doing. I just think that it's something to be proud of. It's something different. There is no other Department of Social Services in the state of Maryland doing the type of work that we're doing.
I think that our collaboration across the 4 sites as part of the QIC has been really helpful in thinking through our own implementation and improving our ability to do this work. So I think the idea of continuing collaborations is something to consider for everybody doing this work. We're not doing it in isolation. And even if our child welfare systems and jurisdictions operate a little bit differently, it's really helpful to have that space to talk about best practice, to connect with other practitioners, and to really have some support around data and remembering the importance of data and how it helps sort of drive outcomes. So just a quick shout out to the space that was created by the QIC, and not just the folks that work at the University of Maryland. Of course, they were immensely helpful in all of this, but really to all of the other sites, the 4 sites where we were able to come together and build connection and community with them to be better for all of us to be able to implement this work. We learned a lot from the other sites, and hopefully they learned something from us as well. And so I'm just really proud of how hard my team has worked. We have gone from implementing 1 intervention to now 3 or 4 different interventions in a very quick space of time. We've adapted everything from in-person to virtual. We have not missed a beat. We made sure everything continued for queer and trans youth and families, because we know that this is effective, it's important, and it's really making a difference in our community.
So for me, one of our success stories I do feel very excited about was a young person who has been in foster care for 10 years, came out in foster care and has been living in residential for the past 3 years. And when we did family finding, found his paternal relatives and asked how he wanted to meet people, and he wanted to go to a family picnic. And it was the summer, and the 4th of July was just around the corner. So to the point about partnerships, being able to ask that residential treatment facility who said, no, we don't know these people, he can't go, to be able to go to our partners to say, can you help us get permission, and then have him be able to meet I think more than 30 people came to meet him that day. And he's continued to build the relationships with more and more of his family members. And he was 17, or is 17. So that's a success as far as I'm concerned. That he, and one of the things he said when he left with his Connect worker that day was, I have family, I have people. You know, he's been alone and thought he had no one, or that no one cared about him, and they do. Yeah. They care very much about him. So it was really I was there, and it was just amazing to see all those people hug him, to see him with people he looks like was really, really, a lot of his adult siblings were there. It was really awesome for him.
I think every time that I am in a room with young people and families who have experienced these interventions, or a Zoom call now, I continue to be inspired by the work that's happening within the local sites. And I'm so proud of it, because these young people and parents are able to talk about the impact that these models have had on their lives and other young people that they're working with. And that's why we're doing this, right? That's the biggest part of it. I'm so proud of that.
I think as a system also, we need to recognize that there is much, much more work to do. And this is really just the foundation, right? This is moving to a place of understanding that SOGI is a safety concern, that SOGI is critically important in our decision-making at every point.
We actually want to say that we are a inclusive, well-informed, self-aware system. And so for me, all of that work needs to move forward at rapid pace. we need to, I mean, all sorts of levels, right? We need some lobbying. We need legislation change. We need standards of practice and regulation within our congregate care facilities. We need to build our cadre of all families as affirming families.
I think the field needs to know the importance of representation and the importance of how that representation can impact the effectiveness of the interventions and the services that you want to provide to the LGBTQ community. There are many subcultures and subgroups and identities and experiences that we talk about and that we learn about and that we research. And I think that it's really important to have those identities and experiences represented at the table, represented in our focus groups, represented as staff and participating in the interventions that are provided.
So through our work in the QIC, we have a roadmap that tells us next steps that are not just theoreticals, but based on what we're hearing directly from LGBTQ young people, directly from workers in systems of care, directly from parents of LGBTQ young people. We don't have to guess anymore. We know the next steps.
At the end of this project, we now have 9 manualized programs for LGBTQ youth, families, and their workforce. And when we started, there were only a couple in the country. So that is a huge add to the field. And this means that other agencies are going to be able to pull these programs off the shelf, read the instructions, read the lessons learned and the best practices, and implement the models fairly easily. Not only that, but most of these programs have both an in-person version and a virtual version. That makes it really adaptable to implementing these programs in rural settings or with populations that may have childcare or transportation barriers. And another huge accomplishment is that we have data on 90% of these interventions. So we know a little bit of something about how they work and how they don't work. And that is a huge accomplishment, especially since we had to shift everything to virtual formats. So having some kind of data for 90% of interventions is really big. And we also know a ton about what it takes to implement these in a child welfare setting. And so we plan to disseminate this work through different types of manuals, videos, conferences, to let people know how these programs can be implemented also, within the system, but also with young people and families that may be going through lots of different challenges in life. And so that is going to be an important add.
And I also think that when we began this process, we thought, you know what, we're going to study 4 to 6 interventions, which is fantastic, right? I'm not minimizing that. But because of everyone's commitment to the work and this population of young people and their families, we wound up evaluating 16 variations of interventions. And now we have manualized best practices for a culturally adapted family finding model, multiple clinical interventions for young people, for parents, for families as a unit, training models for the child welfare workforce and foster parents, and data collection best practices. And that is more than we ever dreamed of. And I am so proud of everyone that was part of this to make that happen, because it truly has the ability to impact LGBTQ youth and their families across the country once we're done with this and we have these practices that are going to be available across the country.
Any surprises? I mean, just overall, like the family I built, is a surprise to me, because I never thought that I would find, a group of people who have not even just been in the same situation as I am, but actually care, actually want to make a difference. I've always wanted to make a difference in my head, but I never knew that I would find a program that will actually help me build towards making a difference and, making a change. So that's what's most surprising to me, finding people that actually care. And, yeah.